thank you very much for the invitation. And so direct-to-consumer digital health or non-prescription digital therapeutics is really a passion of mine, and it's the work that I've been doing for the past couple of years, actually more than that. So I've had a career spanning in different kinds of innovations inside healthcare and outside, and I've worked on things like, building new business models, new partnerships, pharmaceutical products, but also digital health in terms of services. And I've had, the fortune of being able to work across different sides of the health ecosystem. So I've been on the payer-provider side, I've been on the investor side, and then, in a pharma company, then obviously, research and developing new therapies, but also now, in recent years in digital health, it goes beyond, I think, what we see possible with just drug therapy alone, and especially in the area of chronic disease management, where people are living with their conditions day after day, and they are making health choices knowingly or unknowingly in their daily choices that they make. So being able to facilitate sustained behavior change is something that, drugs or healthcare professionals, cannot be by the side of people with chronic conditions day in and day out, reminding them to do this or to do that. So it needs to be something that inherently is somebody that is motivated to want to change. And then there are all these tools available now to help people on that change journey.
Yeah, you shared with me, just how important that, chronic disease management combined with digital health can make such a really big impact. And then just in terms of using it for diabetes, talk to us a little bit about, kind of why starting there.
Right. I think we all know that diabetes represents a huge cost, and it's not just about the disease of diabetes itself, but also it's to do with all the complications, the macrovascular, microvascular complications that come with diabetes, the risk factors, and also things like renal impairment, renal failure, end stage, etc., that all come as part and parcel of a person who lives with diabetes who's not well controlled. And just earlier in the month, we saw in a new study coming out on the updated economic costs of diabetes for the US, and staggering, 413 billion of costs in diabetes, out of which 307 billion is related, to direct costs associated with the care of diabetes. So it's a huge amount and a huge burden, not only in the US but also globally. And we've also seen published data that tells us over the past 12, 15 years, even though there's been a lot of new classes of therapies in diabetes, the control, so, A1C level, overall, we are still seeing 50% of patients uncontrolled, on diabetes. And so it's not for the lack of, therapeutic innovation, so then something else must be going on that is, and people are not managing well. And we've also seen that health outcomes are not just determined by medical care alone, and it is 10 to 15% by medical care, about 40% by behavior, some percentage of social determinants of health, and also a little bit of genetic factors as well. So I see the potential for digital health to address a lot of those things that are beyond just traditional medical care that we focus a lot on.
And you mentioned prescription digital therapeutics in contrast to direct-to-consumer. Can you kind of tease that out a little bit more and go through those differences?
Sure. And I think the simplest way to look at it is who decides whether to use it. Right. So the direct-to-consumer digital solutions that are, for chronic disease management, like what Dario has with diabetes or hypertension, etc. So those are the user, whether those people are patients or not, because you've got some solutions out there that are for pre-diabetes as well, so they're technically not a patient. And so you have people who can choose to adopt healthier lifestyles and healthier behaviors. They can still be measuring their blood glucose, even if they don't have diabetes, etc. Versus prescription digital therapeutics that has to go through a regulatory approval process that has more stipulations about what must happen in order to prove that you are ready to be prescribed. And the decision to prescribe rests with the healthcare professional. So those are, I think, the main differences, but at the same time, there are also nuances about the burden that digital health technology, poses also on the, to healthcare practitioners. We've seen, surveys done by the American Medical Association. They run a digital health survey on physicians every 3 years, and is very clearly seen that, there is a lot of wish to adopt digital health technologies, but at the same time, adoption, we know, has been slow. And part of this, the lag in the adoption, is because of things like, obviously, physicians want to know whether it works or not, but at the same time, there are questions about, liability. What if I get a lot of data that I can't monitor? And then if I'm not paid for additional monitoring, who's going to do it in my clinic? How does it fit into my workflow? And all these that are not necessarily related to clinical effectiveness, but is really around workflow and implementation that hinders adoption. Whereas I think for a direct-to-consumer digital solutions, they are actually there to help support the user or the patient, on a daily basis, in lieu of, having some, a care provider, with them. So it's really a good companion for people to have as a support system, and at the same time, it can, digital health solutions, especially those that are, more with AI incorporated. There's much more opportunity for personalization, right? So, in terms of drug therapy, we can get closer and closer to precision medicine, but no way to the extent that digital health interventions can, be tailored to a N of one. The system or the app, can take into account your demographic details, your habits, your preferences, and then they can interject with prompts and interventions at a time when they know that you're going to be more receptive, or in ways that they know, it will be more accepted, by that individual. So I think there is a lot of opportunity there to help alleviate burden from the healthcare system overall, and support things like especially if you have a constant stream of data being collected, on your app that you can then take to the doctor for a next consultation, then it helps with the richness of that conversation with your care provider. So it can add more than take away.
And you mentioned Dario and some of the work that they're doing. Where do you see kind of innovation in this digital health piece moving forward, especially around, kind of all these new GLP-1 agonists and new medications coming out? How do you view the digital health piece in relation to those kind of new medications?
Yeah, it's a good question. So, a lot of these direct-to-consumer digital solutions, they are not in themselves, potentially, they are not therapeutic treatments, right? So that's why they are in the classification, that they don't have to be regulated by the FDA. And so by design, they are meant to sit on top of usual care of drug therapy. And so, for example, people taking GLP-1 who may also be on the Dario app, may experience, improve things like, engagement, or, or there may be additional benefits beyond just the clinical benefits of the weight loss and the reduction in A1C. Because we've also shown in a separate study that, using these direct-to-consumer digital solutions like Dario can, in fact, by themselves, also reduce, A1C on top of, whatever usual drug therapy there is. Of course, I think the question is still out there. How does it complement, things like GLP-1 that is already so effective? And I would say it's less to do then with adding more on already a very powerful and potent drug in terms of, for example, reducing A1C, but it is, much more holistic in terms of helping a patient stay engaged, or they may stay, more adherent, on their treatment, or, there are other aspects of lifestyle therapy, lifestyle choices that they need, because every diabetes treatment is supposed to accompany lifestyle change. Right, so with every new diagnosis of diabetes, the first thing before they get put on drugs is lifestyle intervention. But of course, a lot of the time that gets skipped past very quickly with then people are already on drugs. So I think with digital health technologies, like what Dario has, it helps bring back that lifestyle intervention into a way that is more tangible than in the past when, a doctor is trying to give, lifestyle and dietary advice or exercise advice, and then, 1 year in, 1 year out, or the patient is not, in the right frame of mind to receive it at that point in time in the consultation.
And then how can you see our role in advancing direct-to-consumer digital health for chronic disease management? Yeah,
so I think, first of all, I think for innovators, out there, I think one of the things is, really include key stakeholders early in the process, right? I've met a lot of great technologists and people who can build great products, but they are so focused on the product itself that they haven't thought, through enough about where does it fit into the market, who are going to be the people using it, who's going to be paying for it, and how does it fit into existing systems, or which existing systems does it need to connect with. And so I think that, is something that digital health, more so than just products and artifacts, we need to find how it can actually integrate rather than add to the fragmentation that we have in the healthcare system today. I think for investors, a lot of investors you get investors coming into digital health from different sides, right? You have technology investors that, come over to health tech. You have traditional healthcare investors who are much more used to the robustness of what they see for drug and drug development, or device development and regulatory approvals as gateways and milestones. I think digital health can be a lot of different things, and there is no one size fits all. And we really have to look at what is the intended use of the technology, and as to how that fits in with the rest of the ecosystem and what value it provides for whom. And it's going to look very different across, I think, different digital solutions. And then for healthcare professionals or healthcare providers, to me, especially on the topic of direct-to-consumer digital therapies, I find oftentimes there's apprehension or there's skepticism by healthcare providers. This is not something I've prescribed for you. I don't actually know exactly what it is or how it works. So they don't actually embrace it as part of the overall care package or the overall care plan for that patient. And I think that may be missed opportunity, because especially what I mentioned earlier, there's a lot of data that gets collected, and this data can actually help you make better choices, or make better informed choices, have richer conversations about what's happened in between points of care. And so I think coming with a more open mind, that today in the world of consumerization of healthcare, people are more empowered to know what is going on, and to have a much more level playing field dialogue with the person living with different conditions in front of you. So hopefully that's kind of covered different players in the system. But I think one of the key things for me in digital health is the emphasis really to collaborate. And I know different speakers have talked about it earlier today, but I find it especially true for digital health, because there is no segment of the ecosystem in healthcare who can claim to own digital health. It's not the device companies, it's not the pharma companies, it's not the payer or health plans, it's not the provider systems. Everybody knows that there is some value to derive from digital health, but at the same time, it's not squarely fitting into anybody's agenda, but it is on everybody's agenda. And so therefore, to me, that is a big call out for much closer collaboration.
Thank you. I think that's an excellent way to kind of wrap up our discussion here. Really important to collaborate and engage with all the stakeholders in the ecosystem. So thank you again very much for your time, Felix. And I encourage everyone to engage at our next networking break and get to know Felix more.
Thank you very much.